My name is Dustin. I'm a physician assistant. I work in the field of spine surgery, and I found that for a lot of our patients post-operatively, they don't have a good idea of what to do for their necks to get the range of motion back and to help with a lot of the tightness that they experience following the surgery. Post-operatively, they're placed in a cervical collar, so they don't have a lot of range of motion for about 6 weeks afterwards, and a lot of times they'll come out of that collar with a lot of stiffness, and as a result they'll have a lot of pain. So this video is to help the post-operative spine patient with range of motion and some stretching for their neck, shoulders, and upper back. This is also good for anybody who has neck pain and they may be suffering from muscle tightness and spasms, or it could even be a good warm-up or cool-down following an upper body exercise routine with arms, shoulders, and back. So the first thing we're going to do is turn the timer on.
So I know how long I'm going for. Now this is not going to work because it won't stay lit up. So I guess I'll put the timer on my watch here, as much as I don't want to.
Okay. So the first thing we're going to do are just some simple neck rolls to get everything warmed up and start working on the range of motion. So here we go. Bring the head down, slowly roll it to the side. Okay, and you go back and forth here nice and easy. You can kind of roll it around. Go back a little bit, nice and easy. This is something you could do for 20 to 30 seconds just to get a nice range of motion, a nice little stretch there on your neck to get things warmed up. Okay, the next thing we're going to do is a stretch for each side of the neck. We'll do one side and we'll do the other. And the first thing we'll do is you put your right arm behind your back, grab it with your left hand, pull your left hand over, you make a little wing on one side, and then you tip your ear toward the winged side, toward that shoulder, and you just hold it. And you'll feel that stretching on the lateral aspect of your neck here. After about 10 or 15 seconds, you can look down. You'll feel the stretch change somewhat. You'll start feeling it more in the posterior aspect of your neck. And hold that. And then you can look up, keeping your head to the side. And you'll feel that in the anterior aspect of your neck along the sternocleidomastoid here. And you hold that for about 10 or 15 seconds. And then we come out of that and you switch to the other side. You grab your left hand with your right hand, make the wing on the right side, and you can tip your head to the side toward that winged shoulder. You can look down. The reason for the arm behind the back and the wing is to help to keep the shoulder down. And we look up. Again, that's going to get the anterior aspect of your neck here, the sternocleidomastoid. When we do these stretches, the wing part and holding your arm here is more to keep your shoulder down. A lot of times when people have pain and they have decreased range of motion, when they do their stretches, they'll go to the side, but their shoulder will come up, they'll lean. And that's really ineffective. So this helps to keep the shoulder down so that you can maximize your stretch rather than doing this. So that's what that is for. And you can do these a couple times or just do them once, whatever your comfort level is. The fact that you're doing them is the main key to improving. The next one we're going to do is for our upper back and shoulders. You bring your right arm up and you just cross it over in front of you and hold it with your left arm like this. This will help to stretch in your scapula here. Get the mid-trapezius down your mid-back and your rhomboids. And you hold this for about 10 or 15 seconds. And then we can do the other side. This will also help to stretch the lat. You can see how I'm getting a stretch along my scapula here, my posterior shoulder. Works very well. If all of this is tight, your shoulders are going to be tight. The next stretch is going to be one for the upper back, the upper thoracic spine in between your shoulder blades. You just put your arms together, you can cross your fingers, you bring them out in front of you and just try and squeeze your shoulders together. I like to hold my hands like this, maybe because I was a diver on the swim team in the past, it just feels right for me, but what I try to do in my mind is I try to feel like I'm squeezing my shoulders, trying to touch my shoulders together in front of me. And what you really get out of this is you're really stretching your scapulas apart in that upper back. So again, it's a good stretch you can hold for about 15 or 20 seconds. It doesn't take much, you just need to do it. For those post-operative spine patients who have been in a cervical collar for anywhere from 2 to 6 weeks, if your physician has you in a cervical collar, some don't, depending on the levels of surgery they've had done, then a great move for you will be to work on just simple range of motion, where you rotate your head side to side. Depending on the amount of levels you've had fused or the amount of levels the surgery was done on, will dictate how much loss of range of motion you'll have. If you have a 4-level fusion, that's roughly a 50% loss of range of motion in your neck, but about 50% of the range of motion for rotation comes from the first 2 vertebrae, which are typically not fused in most people. The ability to extend and flex your neck comes from the first vertebrae in between your skull, 50% or so there. So you should always have about 50% range of motion in your neck, no matter how many levels you had fused, unless you're a rare occurrence where you get fused all the way up to the skull. I like to tell my patients to, when they're doing these range of motions, to make sure that they visualize how far they're going so that over time they can increase the amount of movement that they do. If you're only rotating a very little bit, you're not going to get much out of this. So you have to go a little bit if that's all you can do, and the next time you try and go a little further, and a little further, and a little further. That way it becomes effective over time. So I hope this video helps you guys out there. If you like this video, hit the like button and subscribe. We'll catch you on the next one.